Good afternoon. I'm delighted to welcome you all to the first series of webinars with one of our head line sponsors, Legrand Assisted Living and Healthcare. This is a great opportunity to hear from Chris Dodd, the Managing Director, about how they've been coping with COVID-19. We're in week 11 now, and it all seems like it's a bit of the normal. Our tech sector being really fantastic in being agile and flexible and reactive to make sure that we're delivering really fantastic, safe services. But it'll be really interesting for us to know from Legrand, one of the market leaders, about how they've supported you as providers and what they see will be the future for us as we start to see some recovery and rebuilding our sector. So over to you, Chris, and welcome. It'd be great for you to just share with us what the pandemic's meant for Legrand and what's your position as a business.
Okay, good afternoon, Alyson, and thank you for inviting me along to give you a little bit of an insight into our world. I think the first thing to say is this virus is a terrible thing. And my heart goes out to anyone that's been impacted by it, and especially to those that might have lost loved ones or friends as a consequence of the pandemic. I think as we work alongside the health and social care sectors, it gives us a little bit of an insight as to how hard people work in supporting the elderly and vulnerable. And I have the greatest respect for those that are working on the front line in the fight against COVID at this time. I think given that we provide technology solutions to help our customers support the elderly and vulnerable, we always knew that we were going to have to step up to help them in support of this fight against COVID. And to start that journey, the first thing that we had to consider was how we could continue ourselves to operate effectively and efficiently. And our manufacturing unit up in the northeast of England in Blyth, and our colleagues there have worked admirably during this period. The manufacturing facility has remained open. We've obviously had to make some significant adjustments to ensure safe working, whether that be social distancing, whether it be regular sanitisation, adjusting shift patterns, temperature checks for people coming in, amongst many other things that we've had to do. And also for our back office colleagues, they successfully transitioned from coming into the office every day to working from home and continue to do so very successfully. And then for our field engineers, we've had to adjust our risk assessment processes and our method statements to ensure that they can continue to support our customers should they require any field maintenance or rectification services as required. And our business development managers, like all of us, have had to embrace video calling. So they've continued to help with product demonstrations and training and support from our customers using these techniques. At the start, which it seems such a long time ago now, such a lot has happened along the way. We did get numerous requests from alarm call receiving centres to help them deploy their resources, their people, their call receiving staff to home. And very quickly, where we could, we were able to install, configure technology to allow that to happen, largely remotely, which was useful. And we also produced a range of videos to help our customers, with operators now trying to log on from home, and also for new operators coming to the service maybe in that time. And also for our applications, our call reassurance applications and call minding applications, so they could understand how best to get the benefits from those. At the same time, we saw a significant increase in demand for our digital reach IP units, which are largely plug and play devices, so they're very easy to install. They were particularly useful in discharge from hospital to home programs, which in normal circumstances might have required an installer or an advisor to make equipment operational in the home. But in most cases, people were very easily able to take the equipment, plug it in when they arrived home, and it downloaded its configuration from the cloud, and then the service provider could continue to monitor and manage that. So that was a big step up for us. And for sheltered accommodation, where many people are shielding, many elderly and vulnerable people are shielding within those environments, we're using our reach units to ensure resilience. Where people weren't able to allow engineering staff into their own home, we can provide our reach units again, which are easy to deploy in such circumstances. So much so that we've seen for the first time digital alarm unit sales, our reach alarm unit sales, exceed those of the more traditional analog devices. So that was very interesting to see. On the healthcare side of the business, understandably, this has been impacted. We've seen reduced number of installations into care homes, but we continue to support and maintain individuals' systems as best we can in the circumstances. And for the NHS, with our nurse call systems, we've supported the increase in capacity, whether bringing new systems, new wards into operation, or expanding existing wards. And we've also installed our systems into some of the new Nightingale Food Hospital environments, particularly at the Dragon's Heart facility in Cardiff and in Liverpool. So all in all, incredibly proud of the way our teams have stepped up to the challenge. One particular example out of many, which was regard to a Nightingale facility, where we received the inquiry one Tuesday night back in early April. The team got together, reviewing the specification, putting the quote together, submitted that next day. We received the order that afternoon. Colleagues in the factory got their equipment together. We were on site on the Thursday, and the installation was completed and handed over by the Saturday afternoon. So sort of 4 days start to finish. So we've been incredibly busy during this period, much more so than we ever thought we would be, or would have been in normal circumstances, I think.
Fantastic. And I don't know whether you're aware, but our new director in Scotland is Dr. Lynn Douglas. She's the CEO of Field Housing. She fed back about how supportive you've been in ensuring that her whole business actually were deployed at home, and home working was in and introduced very, very quickly, including the monitoring centre. And she said the performance has been absolutely fantastic. The support she received was really brilliant, so that they could get the whole monitoring staff functioning effectively, safely from home. So well done, Chris. That's really fabulous.
That's great to hear. Thank you for that.
Yeah, I personally think, we've all done well as a sector, and what we did, our leadership report last year said, let's look at digital, let's look at workforce, let's look at data, and more importantly, let's look at partnerships. And I think what we've seen over the last 11 weeks is our sector put together to deliver fantastic services that we need and that business continuity. But I'm interested, I know I joined some of your breakfast seminars last year, which I found really informative. And I'm aware that you launched in January your white paper, Unleashing the Digital Premium. Now, that's about us looking into the future, and I'm really keen to know what that will give us as a sector and how you'll use the insight to drive things forward for our sector and our clients.
Thanks for feeding back those comments. With regard to the white paper, we were incredibly pleased to be able to support the Good Governance Institute in the preparation of this national white paper. And it really did dig into some of the challenges and opportunities in making this transition towards digital, and what could be the benefits. And we call that the digital premium. And I think it's important that we do realise something beneficial out of this technology change. As you said, the paper was the culmination of a number of sessions, face-to-face sessions with colleagues across health, housing and social care, and also a number of interviews with people across the sector. So a great deal of insight was gained throughout the process and brought together within the white paper. And as you say, we launched that in the House of Lords earlier this year. I think for us, the thing I'm always conscious of, that any technology shift, like this analog to digital shift, can be seen by many as just another expense. It's just a new technology, and there's no real gain or benefit over the existing technology. So we were really keen to explore the potential that digital can actually bring, and to be able to examine some of the opportunities, to look at what challenges there may be in realising those opportunities and how they could overcome. So that was the real purpose of the paper. I think we all know much is spoken about analog to the technology shift. We know the size of the UK market, the tech sector in the UK. This was never going to be an overnight process. It was something that had to be planned and thought through and executed in an appropriate way. But we're really excited by this new dawn. We're excited by some of the opportunities that have been examined within the white paper. And again, some of the things are to hand. We all know there's a wealth of data that we collect across the services that are provided. But how do we better share that data? How do we make better, more informed decisions to improve the welfare of individuals and the quality of life for the people that are supported? I mean, the paper captured a number of challenges, but it also looked at some real good practice where people were overcoming those challenges and already using digital to best effect. I mean, the UK is in transition. I think there's no doubt about that. We're in a transition phase from analog to digital. I think the important thing is that everyone has a plan, whether it be ourselves in terms of a provider of technology solutions, whether it's an organisation providing services, or wherever you sit, you need to have a plan and you need to be assured that you're executing that plan. I think the important thing within the paper was really the last page, where it threw out some challenges to the boards within our health, housing and social care sectors. So posed some really insightful questions for boards to consider as they move through this period of change. And if anybody's interested in reading the paper in more detail, it can be downloaded from the TimeTech website. Just search for Unleashing the Digital Premium. So yeah, I think it was a really important piece of work and very timely, as you say.
Absolutely, and I think over the series of the next webinars, over the next 12 months, we'll be able to talk through some of your delivery things that you're developing. But we're all creating the new norm. What will the new norm look like for technology-enabled care? And I think there's some key things in the paper that we can work on together to get that out to the sector. I'm delighted that you're focusing on the boards, because digital is a key strategic risk that should be on everybody's risk register. And together, it would be great for us to get those messages out to our colleagues in health, housing and social care, so they actually know what the challenges are, but more importantly, what the opportunities are. So thanks for that great piece of work, Chris, and I'm really keen to follow that with you over the coming months. We've talked a bit about digital, and you've said that that's been the priority over the last few months, and we've talked a lot about that date of 2025. I think we're all seeing that our public push, where our consumers, the shielding, they're all using digital, and it is going to be the norm. I'm just wanting you to maybe tell us, how ready are you for it? and what plans do you have in place for supporting all of your customers, not just the ones that have been reaching out for the digital?
Yeah, I think in terms of where Legrand is at this moment in time, we've been investing heavily for a number of years in our technology platforms. We've transitioned all of our technology platforms from analog to digital. They're all digitally capable at this moment in time. I think another part of this, we've seen through the British Standards Institute, we've seen recently the publication of two important digital communication protocols, one particularly for the alarm units, the dispersed alarm units as we describe them, and one for the equipment used in specialised group living environments, sheltered accommodation, those types of things. So I think they were very important milestones in this journey. They're now published. We've now adopted them within all of our equipment as appropriate. And I think often we see standards as lagging behind the technology shift. And we see standards be slow to respond to changes in technology. But here I think we've seen clear leadership supported by the TSA in bringing forward this framework for interoperability that allows technology from whatever the source to interact and operate seamlessly together. So I think that's important. And I think the other thing is this is not the status quo. This is going to change. Needs are going to change. Needs are going to evolve. And again, through the BSR, we have a framework now for the protocols to evolve as the needs change. So I think that was a very important step, and I think for the sector, lots of people involved in that process. We should be very pleased that that's now done and dusted, and we can move forward from that. In terms of the other aspects, we should always be mindful of security whenever we bring forward any new technologies. And analog technology, despite its limitations, has served us well for many years. Let's ensure that we protect the gains that we have made as we move into this new technology age, this new digital technology platforms. And what we've done within TimeTech and John Tech is we've created a secure ecosystem for our projects and to operate, and for our customers to access the benefits, whether that be devices using mobile networks, whether it's devices using fixed wired networks, or whether it's even devices using both types of networks. So people can be confident in the fact that we have a resilient, secure network in which the equipment can operate. Also, these are great learnings here as well. And we do have a team of experts within the business and partners who are there to be able to assist our customers in supporting them in making this transition. And also, the white paper, we were very keen not to lose track of the fact that we've got this white paper now. We've got a number of challenges thrown out by the white paper, and the fact that we need to build on that and to take that forward as we move into this digital phase.
Fantastic. As you know, quality outcomes in our quality framework it goes right to the heart of everything we do in TSA and tech quality, and let's continue. Yes, security is important, quality outcomes standards, we need to align everything. And yes, we've done, but there's still some others. There's other developments that we need to progress with. So let's continue our joint working. We're looking forward to the new, Chris, and as we come out of our business continuity stages and we start to look at rebuilding the sector, our government's telling us that we're in this for the long haul. It's likely to come in then rebuild. From your perspective, what does the new world of tech look like? What do you aspire it to be? That would be great. So you can maybe set
wow. That's a big question. I mean, going back to the white paper, I think it was in some respects it was summed up very well by Jeremy Porteous the chief executive of the Housing Learning Improvement Network, where he said something along the lines of, providers have now the opportunity to think about how they can change the way they interact with residents. The more traditional model of reacting to events, reacting to a crisis and intervening at that point, they can move to being data gatherers, so they can capture data that will inform the services that they offer. They can move to being data sharers, so they can share information with other agencies, with other organizations to ensure better outcomes for individuals. And they can data assist. They can provide information that might lead to interventions beforehand, which might avoid things happening that otherwise might have led to a crisis. So, as we move forward and the launch of our digital systems, we're hoping that some of these things can become a reality. Certainly with the ability now to capture data continuously. We're no longer reliant on dial-up telephone networks. Using modern techniques, machine learning algorithms and data, we can start to think about how we might have solutions that predict things, and with a suitable intervention, a crisis could be avoided. The one that I speak a lot about is falls. Now, falls, and as we all know, are not always just a consequence of a trip hazard or an accidental stumble of some kind. They can be as a result of a long deterioration in a condition of some kind. They're not always signaled by a single factor. They might come about by lack of movement, people having to sit in a chair for a long period of time, lack of nutrition or hydration, or over under medication. And with other data sources, this information combined might be able to give us an indication that something's likely to happen in the near future. And again, with that suitable intervention, that it can be avoided, which is obviously of a great benefit to the individual, but also to the whole health economy. Whether that be specifically in health or whether it be in social care, it's very, very important. And I think also, this goes hand in hand. We need to think about how our services will transition. This is going to require a transformation in service delivery, moving from the reactive to the proactive. We'll never lose the reactive requirement, but we need to think about how we going to react to such information in the future. So again, that goes back to some of the questions which are posed in the white paper to boards. Are they thinking about how best to engage all stakeholders in their digital strategy? So I think yes, some important food for thought that came out from that quote from Jeremy there.
Fantastic. I think what COVID has given us is a huge opportunity to be more relevant in population health service delivery. And I think we're seeing that up and down the country, where our services are being used to support the shielding, so the most vulnerable, but also the tracking and the tracing. And it's our time. I truly believe, being in the sector for over 20 years, this is our time. We've banged the drums for a long time saying tech works, tech delivers really great outcomes.
Yep.
This is our time to really show how we're really relevant and important in that whole system. So I would just like to thank you today, Chris, but more importantly, thank your whole team at Legrand, because what you've done is you've allowed a lot of organizations to, one, survive, be sustainable, and continue to deliver those fabulous services. So without you, I think some of them would have struggled. So I'm sure from all our service providers out there, a great, huge thank you is well deserved. And I'm absolutely looking forward to our next, engagement, our next contribution, to see how your white paper comes into reality. So until next time, thank you very much, Chris.
Yeah, and thank you, Alyson. That's very kind of you. And I think I just one thing I'd like to say at the end. I think we've had an insight, and if we take anything from COVID, it's given us the opportunity to see some of the benefits that digital could give us. I think let's hope that COVID goes away now and we never see it again. But should there be a resurgence, let's ensure we take this opportunity within an intervening period, if it is to come back in the winter, to accelerate those programs. I think the last thing that we'd want to do is go back into this in the winter period being unprepared. So let's take the opportunity now to move forward as much as we can in that time. But thank you very much, Alyson, for the opportunity to
Well done, and good luck.
today.
Good luck with all your developments over the summer. And we'll keep in touch, and we'll keep feeding this back to the sector and support them on their journey. Well done. Thank you.
Thank you.